a healthy nail, let's look at the cuticle. It's also known as the eponychium. That's underneath that area at the base is where new nail grows from. It's called the matrix. That little moon-like white covering, that's called the lunula. And then the nail bed is the pink area, and that's a very healthy looking nail. If your nail looks like that, you're good to go. But let's start looking at some more pathologic nails. In particular, up here we have what's called a half and half nail, where literally it's half white, half red, and it no longer has that nice little lunula. Let's talk about what that could mean.
Well, half and half nails are known as Lindsay's nails, and the idea is it can be a warning sign. It's typically seen in patients with kidney disease. And what you're seeing is you're actually having that change. It's due to edema, and it's also sometimes due to melanin. That's why you're getting that color change. And it's about half of the nail becomes white, and the distal half is red.
And it's important. If you come in, let's say you come in to your doctor or the emergency department, we're not going to diagnose kidney failure with that. And it could mean other things. But it may help lead to doing a blood test, checking your urine, and allows one more physical diagnosis to lead us down the right path.
Clearly there is something to it, because I've read that up to 70% of people on dialysis are going to have that half and half nail.
Speaking of this other nail, something that women definitely need to take notice of, because it's 3 times more common in women, are these dilated or broken blood vessels around the nail. And that can be associated with autoimmune disease. And again, that's more common in women, things like rheumatoid arthritis, scleroderma, lupus. This can be an indicator or harbinger of that. And the fancy name for those broken capillaries is telangiectasia, right?
Telangiectasia is correct.
And you know, and just looking at the picture, it almost looks like this could just be an infected nail, but you got to look closely. You see the little tiny blood vessels.
We're talking about these little tiny blood vessels here. This area around here, you can get that with just an infection, but these little tiny vessels.
We actually take out a scope and look really closely, and you can see that it's actually blood, that it's actually broken little capillaries. And those telangiectasias in patients with connective tissue diseases can appear anywhere, on the body, on the face, but you really do want to look at the nails.
You really have to, consult with maybe a rheumatologist or something like that if you start to get, weakness, fatigue, things like that that are associated, the vague symptoms that are associated with autoimmune disorder.
And when you're seeing those symptoms, the idea is that if you're looking at the nails, it can limit your differential diagnosis. It can lead you down a certain path for a workup.
And Dr. Lee, somehow you move just a little bit, because I want to point out this nail. It's a little bit like the half and half. This is actually called Terry's nails. That's where it becomes more opaque, as you can see there, very white.
And usually the area of color is a lot less. There's a lot more white nail versus the color.
Correct, yeah. We believe it's actually related to some pigmentary alteration and thickening.
But again, it can be a sign of some pretty serious underlying medical conditions, such as liver disease, diabetes, and congestive and heart problems.
That's right. And we'll also see it in kids in severe malnutrition, too.
Yes.
And this next one should possibly occur in all of your fingernails and fingers as well. So we're going to do something, everyone in the audience, everyone at home, take your fingers and bridge them together like this. And if you see that little diamond-shaped opening, and you can see through that, then you do not have this next problem, which is
clubbing, and that's actually seen right here. What you're doing with clubbing is you're actually losing this unguinopharyngeal arc. So it actually becomes more thickened and rounded, so it's called club nails. And there's 3 main causes of clubbing. One is just hereditary, but there's also idiopathic, where we have no reason, and then there is acquired, and that's where we think of things like lung disease and heart disease.
Yeah. Usually in kids, we see that if they have a heart defect that really affects their circulation.
And these aren't clubbing does not occur overnight. Right. Clubbing occurs sort of over a lifetime as you develop more respiratory problems, etc. Take home here is pay attention to your nails. If you see changes, discuss those with your doctor, because again, in a 5-minute visit with your doctor, 10-minute visit, they may not have a chance every time to look at your nails, but if you bring it up, they will. What's one last thing we should look out for?
Take off that nail polish, take off those fake nails, and take a look, because I have patients that will come in and say, oh my gosh, I didn't know that green stuff was under there, and it ends up being a pseudomonal infection, easily treated with antibiotics, but you do want to get it diagnosed and not have it spread.
And so again, put that cell phone down and that magazine.
You can get melanoma under your nail.
That's another big one. That's another big one.
You know, just last week, I thought I had a really dark spot on my nail. I thought, oh my gosh, melanoma. I washed it off. It was fine.